What happens if you skip insulin doses? Taking insulin regularly is essential for managing diabetes. But what happens if you skip a dose? Let us walk through the risks and consequences of missing insulin doses and how to handle it if it happens. Number one is blood sugar levels rise rapidly. Insulin helps your body use glucose for energy. When you skip a dose, glucose can't enter your cells effectively, causing your blood sugar levels to rise. This can lead to hyperglycemia or high blood sugar, which makes you feel tired, thirsty, and foggy. Number two is risk of diabetic ketoacidosis. For people with type 1 diabetes, skipping insulin doses increases the risk of diabetic ketoacidosis, a dangerous condition where the body breaks down fat for energy, releasing harmful acids like ketones. Symptoms include nausea, vomiting, and severe dehydration. It can become life threatening if not treated quickly. Number third is poor long term glucose control. Missing insulin doses, even occasionally, can lead to poor long term glucose control. Consistently high blood sugar can cause complications such as nerve damage, kidney issues, and heart diseases. How to handle a missed dose? If you realize you have missed a dose, don't panic. If it is close to your next scheduled dose, contact your healthcare provider for advice before doubling up. For shorter acting insulin, you may be able to adjust the next dose slightly, but always check with your doctor. Number fifth is preventing missed doses. To avoid missing doses, try setting reminders on your phone or using a pill organizer. Some people also find it helpful to build insulin into their daily routines, such as taking it before meals or bedtime. Taking insulin as prescribed is critical for staying healthy and preventing serious complications. Comment insulin aware if you have learned something new today and share this with someone managing diabetes. Don't forget to follow for more health tips to stay informed and proactive every day. Consistency is the key. Your health depends on it.